As we're talking about breathing easier with asthma, we've talked a little bit about maybe what people think of as traditional inhalers, but are there other different types of medications people should know about or that we should talk about?
Yeah, I think we should. There is something that's called a dry powder inhaler. There are a number of dry powdered capsules within this discus. And on the front, you'll notice that there is a counter.
Okay.
And that tells you how many doses are within it. First, you look at the counter and make sure that you have a dose available. You're going to be sitting up, of course, always when you take respiratory medication.
Okay.
And you're going to open it with your thumb here all the way till it clicks.
Okay.
And then you're going to cock it. And when you open it, it brings the pill around to this mouthpiece area. When you cock it, it punctures a hole in it.
Oh, interesting.
Right?
Okay.
So now you're able to take your medication. You don't ever want to tip it forward or backward. You never want to rinse it out either.
Okay.
You want to hold it close to your mouth, exhale, put it in your mouth, and take a deep, quick breath in, not like the meter dose inhaler. So exhale, whoosh, in your mouth. And you hold your breath, just like you did with meter dose inhaler. When you're finished, then you just close it up, like so, and you're good to go for next time.
You don't need a spacer or any other special equipment, it's just really that disc.
No spacer.
Okay.
And oftentimes you don't have two doses that you take right away after each other.
Okay.
You may have a morning dose and an evening dose, but you wouldn't take two at the same time.
Is this more of what they consider to be a controller medicine or a baseline medicine, or is it more of a rescue medicine?
There is rescue and there are controllers.
So you just really don't know. It just depends on what you and your physician are doing.
There's some that are combination.
Okay.
And some that are just steroid and some that are quick relief.
Okay.
Not very many quick relief for the dry powder.
Okay. So again, if you aren't quite sure which one's your controller and which one's your rescue, talk to your pharmacist or your healthcare provider to find out so you take the right one at the right time.
That's right. Absolutely.
Okay. All right. Well, thank you so much for that information. I think, when we have talked about over 40 different medications you'd mentioned for asthma, it's important for people to know how to use them so that they can breathe easier with asthma.
That's right. Because there's so many different ones and every inhaler has just a little bit of a different trick to it. So make sure you read the directions, ask your healthcare provider, and you'll be good to go.
All right. Thanks, Nancy.
Yep, my pleasure.